I'm all set to hit the Sunday Matinee, not in audience seat, but as the host. Curtains gonna raise up, no lights. A simple vocal delivery, promising again to steal a few moments from your precious 24 hours of the day. To engrave another learning of the lockdown. Am I inscribing your lockdown diaries? Is my tongue a privileged chisel of this encryption? Welcome all to Is Pharmacology Difficult podcast. I'm your host, Dr. Radhika Vijay, MBBS MD Pharmacology, and this is the audio hub to get the best, simplified basic tips, strategies, methods, and lots of ideas to learn better, understand better, and make your concepts crystal clear. If you really find, and if there's a question hovering in your minds, is pharmacology difficult? Lend me your ears for a while and let in the magic of knowledge. The drug transfer from the administration site into the circulation is termed as absorption. Well, that's the first step in the ADME study. ADME, you remember, another term, a sort of an abbreviation term for pharmacokinetics. I hope you remember what does the capital ADME stands for. And today we are talking about the capital A part. Yes, we are talking about the absorption. The surrounding environment of the drug, the site of absorption, all this guides and governs the rate of absorption. And also, it decides the extent of absorption. Now, for your very kind and surprising, rather not surprising, but your novel information, I want to just tell you, there are a number of factors like chemical characteristics of the drug, then the drug dosage form, and the routes of the drug administration. Now, the routes of the drug administration, they are affecting the bioavailability part also, which we're going to talk about later. As far as the routes of drug administration are concerned, almost all of them result in a partial and low bioavailability as well as low absorption. But there's only one exception, and that is the intravenous route. Yes, that leads to 100% bioavailability and a good amount of absorption. So these are all the factors, the determinants for the rate and the extent of the absorption. Now, let's come to directly what are the different determinants. What are these that are really affecting and guiding the whole process of the drug absorption? Their importance, it lies in knowing the site of the drug absorption. It can be stomach, it can be intestine. Then another good thing, we get to know whether they are able to bypass the pre-systemic metabolism. Now, pre-systemic metabolism, are you getting? That is, they are bypassing the first pass metabolism. Okay, that's the simple type. You can never dream of the best drug administration and improvement in the patient compliance till you know by rote the characters of the drug. Knowing by rote, that is knowing by heart. Now let me quickly list the determinants of absorption, and at the same time I'm going to describe a little about each of them. The first one is the routes of the drug administration. You know, each route has its own unique characteristics. So accordingly, the drug administration, the absorption differs with each of the routes. I just told you. Second important determinant is the aqueous fluid dissolution at the absorption site. Now what happens is, the solid drugs, they actually dissolve very nicely in the aqueous state, not in the solid state, okay? And if the drug is very less water soluble, something like griseofulvin, then it becomes difficult. Absorption is also tough. So we can just summarize that the dissolution rate, it guides and governs the absorption. And here then the pH also plays a crucial role. Like low gastric pH, it really favors absorption of the acidic drugs. Okay, third important determinant is the concentration gradient. Now this is very, very important and main factor, especially when we are talking about the passive diffusion. The concentrated drug absorbs faster than the diluted drug. I'm sure you were thinking the other way round, right? Well, before I studied the whole thing, even I was thinking the other way around. There's no big deal about it. So, just remember this, that the concentrated drug is absorbed faster and the diluted drug absorbs slower. Got it? Keep it in your mind as a key point. Concentrated faster, diluted slow. Okay, moving over to our next important determinant, that is lipid solubility. I told you if they are less soluble in water, it becomes a little tough for them. Then we are talking about the fifth determinant, that is vascularity at the site of absorption. See, if the blood flow is high, just imagine the surface. There's a surface and suddenly a gush of water comes. It definitely removes all the things from the surface. So if the blood flow is fast, then the drug will be removed faster from the surface. But then again, don't take it wrong here. If the blood flow is fast, it is acting as a drying wind and it is hastening the absorption by taking away the moisture. That is just a simple imagination of the dry wind blowing and the moisture is getting evaporated. But apply this concept here. If the blood flow is fast, the absorption will be hastened. Yes. So there are some tricky things here. Firstly, when we talk about the concentrated drug that absorbs faster, I told you before, just a little revision. And the another tricky thing, if the blood flow is fast, the absorption gonna be hastened. Two tricky things, keep in your mind two key points. Don't be confused, don't get your concepts wrong, just get them right. And last determinant is the absorption site, surface area. If the absorption surface area is large, then definitely it will foster and it will support, it will help out a quicker absorption, okay? A faster absorption. And if it is very small, it's narrowed down, then absorption gonna be a little tricky and difficult. That was quite simple. You can all easily guess that, but the two tricky things, again I'm gonna reminding and I'm revising. The concentration gradient and the vascularity. If your concepts are clear, you'll never be confused. Got it? Now, since it's the weekend, I'm gonna keep my talks short and nothing heavy really to overdose all of you. I just want really all to have a relaxing, a little learning weekend. It's the wind o'clock. Yes, the time to wind up. But I will leave you all with a tune riddle. Yes, a little tune riddle of my recent favorite melody. And what you have to do is simply remember and guess the renowned artist. Okay, here we go. Na 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 na, na 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 na, na 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 na, na 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 na. For all the updates and latest episodes of my podcast, please visit www.ispharmacologydifficult.com, where you can also sign up for a free monthly e-newsletter of mine. It actually contains a lot of updates about the medical sciences, drug information updates, and my podcast updates also. You can follow me on different social media handles like Twitter, Insta, Facebook, and LinkedIn. They all are with the same name as Pharmacology Difficult. If you are listening for the first time, do follow me here whatever platform you are consuming this episode. Stay tuned. Do rate and review on iTunes Apple Podcast. Stay safe, stay happy, stay enlightened. Thank you.